If it's not dripping very well, you can always adjust your needle. Sometimes it's just the angle or something that makes it not flow very well. If you're gonna squeeze the bag, you can just squeeze it and then pull it back up and look and see where you're at. If you give a little bit too much or a little bit too little, then that's fine. We just don't want to give her, hundreds too much. Good girl. And it shouldn't take more than a couple of minutes. It doesn't take very long at all. Sometimes whenever you're done and you pull the needle out, you can hold a little bit of pressure on the little spot that you poked. A little bit of fluid might come out, might be like a little bit blood tinged just because there's some vessels in the skin, and that's all normal. There's nothing that you can, poke that's gonna hurt her.
Okay.
Nothing critical. It's all right, baby girl.
You're trying to lift your little leg.
I'm trying to run away.
Yeah, that's pretty much it.
A little bit more. Let me see. Let me see. And these needles that are a little bit smaller, they take just a few more minutes than the bigger ones, but the bigger ones are a little bit more uncomfortable.
Yeah. We'd much rather have her be comfortable.
And when you give her fluid, you can do it in a place, so there we're almost down to the 2.
Mm-hmm.
So you'll roll this back off to lock it. So it'll stop your flow. And then I usually just grab the skin right where I poked so I can pinch it off and hold it for a minute. You can see she's got just a little bubble. It's not a big one because she doesn't get too much. And then you don't have to store this anywhere special. Just room temperature is fine.
Okay.
And then when you give her the fluids, you can always try and make it more of a positive thing. Like give her a treat before, give her a treat after. You don't necessarily want to put her on a table, or something weird. Just do it where she's comfortable on the couch in her own bed, just so that it doesn't become something that she sees you coming and she knows what's going to happen.
Right.
You did good, baby girl. All right, we're all done.